100 areas in the country are now currently under localized lockdown due to the COVID-19 pandemic. The Interior Department says a total of 112 areas were put on lockdown to contain the spread of the virus at the community level. Of those areas, around 60 places are within the Cordillera Administrative Region, 18 are in the National Capital Region, 19 in Cebu City, 5 in Cagayan de Oro City, and 1 each in Cavite, Quezon, and Leyte. The DILG reiterates that local governments must declare a lockdown in streets or barangays once a clustering of cases has been recorded. But not all locally stranded individuals are going to get to go home this weekend. Those bound for the Eastern Visayas will have to wait just a little bit more. Pat Manguna is live in Taguig to tell us the details. Pat, what is in store for our Visayan LSIs?
Sean, there are more than 300 locally stranded individuals or LSIs being taken in by the Philippine Army as of today, and 100 more have arrived as newcomers. But most of them, or majority of these LSIs, will be going home to Mindanao. But the other LSIs who are bound for Eastern Visayas will have to wait for 2 more weeks. After 3 months of being stranded in Metro Manila, Ronald Rada, who lost his job as a construction worker due to the pandemic, wants to fly back to his hometown in Samar. But he has to wait for 14 days before being allowed to go back home.
Okay lang po sana yun para at least kahit paano po makauwi ako doon sa tatay ko, sa bahay ng tatay ko para po may matulugan ako ng maayos-ayos dahil dito po sa Maynila, sa kalsada na lang po ako natutulog, sa bangketa.
Regis Arturio, who is also from Samar, experienced the same fate. He has just completed all documents required, including a travel authority and a medical certificate. But he says he is willing to wait until they are free to go home.
Okay lang ma'am, walang problema basta meron po kaming maayos na matutuluyan po eh. Tsaka support sa pagkain, syempre kasi wala naman pinagkakitaan ngayon, wala kaming trabaho.
The Interior Department said they are just heeding the call of local officials in Eastern Visayas, particularly in Leyte and Samar, to temporarily hold off the travel of locally stranded individuals back to their provinces. This is while quarantine facilities in the region are still being decongested to accommodate additional LSIs. The National Police has also stopped issuing travel authorities to LSIs bound for any part of the region. Only after 14 days or starting July 10 can LSIs be allowed to travel. The Philippine Army said they are fully capable of sustaining the basic needs of LSIs who will need to extend their stay at the Philippine Army Wellness Center or at the libingan ng mga bayani.
We provide them sleeping accommodations, food, and transportation to the airport.
Still, the Philippine Army welcomes donations from private organizations. Since June 12, the Philippine Army has already accommodated more than 1,000 stranded individuals and has so far sent off more than 750. Sean, the Philippine Army will give a little bit of entertainment and exercise for the LSIs here behind me through an afternoon Zumba session. Meanwhile, the newcomers who will be, or before they will be allowed to stay in, will have to undergo a rapid test. While the Philippine Army is waiting the IATF's decision if a PCR test will be a requirement before the LSIs are sent home. Sean?
All right, no end to that story yet. Thank you for that update, Pat Maguna, joining us live from Taguig today. And as part of its safety nets, the Health Department issued qualifications for LSIs or locally stranded individuals before they are allowed to go home to their respective provinces. LSIs must show no COVID-19 symptoms after going on quarantine for 2 weeks. They must also coordinate with their respective LGUs prior to being transported back home. This new protocol comes after a reported rise in COVID-19 cases in provinces, particularly in the Eastern Visayas and Cebu. Some LGUs have claimed that most cases involve returning residents from Metro Manila. The DOH advises LGUs to strongly implement another 2-week quarantine period for LSIs before they return to their homes.
It's not true na pupunta ka lang sa barangay, sasabihin mo lang na wala kang sakit at ikaw ay bibigyan na ng clearance.
And while Malacanang is blaming the public for the rise of COVID-19 cases in the country for being pasaway or hard-headed, Google data shows otherwise. Google Mobility records that movements outside of homes plunged by 90%, while movements in residential households since the lockdown in March have seen an uptick of 43%. Google measured the movement trend of people based on mobile phones with their location histories on. Mobility was likewise limited in Cebu City as recorded by Google. And the Interior Department agrees that community quarantine protocols were generally followed, but maintains that many Filipinos are still hard-headed. And because of this, DILG Undersecretary Jonathan Malaya says the government cannot let its guard down. The United Nations Human Rights Commission reiterates its call for an independent and on-the-ground probe into human rights violations in the country. They also called on the Human Rights Council to strengthen the mandate of the UN Rights Office to continue monitoring the situation in the Philippines. The UN office confirmed that there are systemic killings in the government's war on drugs. By the end of the month, UN Rights Chief Michelle Bachelet is expected to present a report on the country's human rights situation. We're going to go on a quick break, but we will be back with more stories after that. Keep it here on One News. Good afternoon, I'm Shania, and you're still watching One News Now. COVID-19 cases in the Philippines have surpassed 34,000. This is as the Health Department reported over 1,000 new COVID-19 cases today, with more than 780 fresh cases and over 210 late cases. 12 new COVID-19 fatalities were also recorded today, pushing the death toll to more than 1,220. Meanwhile, total recoveries have reached the 9,000 mark, with over 200 recoveries reported today. Meanwhile, in Cebu City, cases continue to surge. 61 out of its 80 barangays recorded new COVID-19 infections in the past 14 days. There is also a clustering of cases in 49 barangays. The agency warns that the capacity of the healthcare system in Cebu might reach critical levels soon, as hospitals are already overwhelmed with the influx of COVID-19 patients.
And as of June 24, 55% ang kanilang capacity for ICU beds or utilization. So ibig sabihin, nandun na sila dun sa nearing nung ating level, kasi ang critical natin, as sinasabi natin, at 7. They have these isolation beds na 84% na ang occupied, and ang kanilang ward beds are almost 64.9%, and mechanical ventilators at 50%.
Meanwhile, the DOH said they are willing to support tuob or steam inhalation as long as it will not have any negative effect on COVID-19 patients. However, Health Undersecretary Maria Rosario Vergeri warns that there is no scientific evidence that steam therapy can cure COVID-19.
But this time, because this tuob is naipalabas na namin dati pa na kapag ikaw ay nag-steam, kapag ikaw nag-misting, all of these things which aerosolize the virus, it may lead to further transmission of the disease.
And Bulacanos can now expect faster turnaround time in COVID testing as the local government over there opens its Gen Expert Laboratory, which releases results in less than an hour. Ryan Ang has the report.
The province of Bulacan is making great strides in their COVID-19 testing. This gene expert laboratory at the Bulacan Medical Center can churn out results for 4 swab tests in just 45 minutes. That's through their new gene expert or the rapid PCR machine. With their license granted last Saturday, operations commenced Thursday. Their personnel passed the competency assessment and are trained in biosafety, biosecurity, and the use of gene expert machine. The gene expert machine is smaller and can accommodate 4 swab samples at a time. The machines were donated by the World Health Organization, and they are still requesting for 1 more machine to the Department of Health.
Kaya lang ang difference niya, maliit lang yung machine. So ang load na niya, 4 lang per test, per sabay-sabay na test, 4 lang. Di tulad yung ating RT-PCR machine, 96 wells So marami.
Dr. Celis, the provincial health officer, said the machine was originally used for tuberculosis and HIV testing.
Actually, pwede pa rin na in the future, pag medyo nag-die down na itong pandemic, i-apply din natin na for testing for HIV kasi pwede din siya. So, 3 tests in 1 machine, sulit na para sa mga taga-Bulacan. Hindi na sila luluwas para magpa-test pa.
According to Bulacan Governor Daniel Fernando, this will help them hasten the testing process to easily identify and isolate COVID-19 positives as well as do contact tracing.
Hindi na kami makikipag-agawan pa sa lung center para makuha namin yung resulta. Hindi na kami makikipag-agawan pa sa ibang testing center na umaabot po ng matagal.
The local government will no longer make use of the RDT or the rapid diagnostic test.
So diretso na kami dito. Kasi una sa akin, wasting of budget, di ba? Wasting ng time. Tapos double expose pa yung aming mga frontliners for swabbing. So bakit hindi na lang isa?
Fernando added that their molecular laboratory building has already been completed and will operate in July. For News 5, Ryan Ang, We Are One News.
Most teachers have yet to be trained for online or distance learning, but the Education Department insists that there's nothing to worry about. News 5's Dale De Vera is reporting to us live from Quezon City to tell us why. Dale, 2 months before the start of classes, how are schools and teachers preparing for this new normal in education? Kaya pa ba humabol?
Sean, with June 30 set as the last day for enrollment, the Department of Education remains hopeful that the number of enrollees will still go up. However, problems haunt teachers as to how distance learning will be done.
One laptop might have to service 2 classes this coming school year. Benji is not keen on buying a new one due to budget constraints. For now, his school principal allows handwritten modules.
As teacher, lagi naman kaming handa So marami namang ibang paraan. So nagagawa naman ng paraan ng school, ng principals, din ng mga co-teachers. So tulong-tulong naman kami lagi. So kung sa pagiging ready naman. Pero yung preparado siguro baka medyo para magkaiba ho kasi yun
The Education Department is confident they are ready for the coming school year. Education Undersecretary Jess Mateo says a study on teachers' preparedness for blended learning show that majority are all set for the next academic year. Mateo explains that school year 2020-2021 will not go full online, meaning gadgets may not be needed for both teachers and students. He adds that 3 modalities will be available: printed modules, online learning, and TV and radio placement instruction.
Doon sa readiness ng teacher na nag-survey kami ng mahigit kumulang mga almost 800 mga respondents, sabi nila 87% may computer Of the 87%, meron doon na internet connection, about 49%. So doon pa lang makikita natin na hindi lahat talaga may kakayahan online.
Mateo says as of June 26, around 14.6 million or 52% of students from last year have been enrolled in the coming academic year. Of this, 14 million will be in public schools, while around 577,000 enrollees will be in private schools. But Mateo remains hopeful that more parents will still enroll their students for continued learning.
Sean, for now, the Department of Education is still exhausting efforts to fulfill its mandate to encourage parents to have their children enrolled in schools before the deadline on June 30th. Sean?
All right, thanks for that update on education. Dale De Vera joining us live today. For more updates, follow News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You may also catch One News on the Signal Play app. Just register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao, and we are One News.